Ladies and gentlemen, friends and neighbors, it's Scott Hammond with the 100% Humboldt podcast with my new best friend and guest, Maggie Kraft. Hi, Maggie.
Hi there. How you doing?
I am very well. It's good to see you.
You too.
It's good to be back here in my podcast chair.
Yeah, after a little trip.
Yep, got out of town, took Joni away for our 46th anniversary.
I thought you were going to say her 40th birthday, and I was like...
My 40th.
Yeah. You started you got married way before you were born.
Yeah. That math does not add up.
Nope.
So tell me who you are. What do you do?
Who am I? Well, I'm Maggie. What do I do? Right now, I'm the executive director at the Area 1 Agency on Aging, and I've been there for since 12, so going on 14 years.
Wow. Ran the show. Tell us about Area 1.
Oh.
A1AA, and you want to call it AAA?
Yeah, we don't have to, since this is a State Farm enhanced show here.
It's not on purpose.
No, I know.
Oh, wait, do I have... Oh, I had it on.
Oh, wait, he does.
Oh, I didn't know.
Oh, he didn't know. Well, the Area 1 Agency on Aging has been around since 1980. And the first director there, executive director, was Patty Berg, who just passed recently this last year already. And it was started when the Older Americans Act, which is a federal piece of legislation, passed to really encourage better services for older adults. Just the same thing that was happening with Social Security and lack of revenue, money for people as they grew older for a lot of people, looking at the systems, looking at services. And so the federal government mandated that there would be area agencies throughout the country. Each state does it a little bit differently, but there's a state unit on aging always, and then there's AAAs throughout the states. And ours, we have 33 area agencies on aging in the state, and our program serves Humboldt and Del Norte counties.
So we serve 2 counties.
2 counties. Some serve 5, some serve 7.
How does it rank in terms of services? Is it bigger, more quality in your mind compared to, say, Imperial or San Diego County?
I think that's not a question. That's not a question that is easy to answer. It depends what you're ranking on.
Yeah.
I would say in terms of volunteers and commitment, we rank top in terms of the people that work with us, the people who volunteer with us, our board, our advisory council. Yeah, we're the best. But in terms of if you're talking funding or available services, obviously, like any other rural area, we struggle.
Sure. Right.
The funding is primarily based on population.
Okay.
So
we're behind the 8 ball immediately.
Yeah, because you have to, any business, you have to have enough money to open your doors and keep your office going. And that costs pretty much a certain amount. And while we don't have the rents that they have in LA, our gas prices are better than any.
Right.
So, I mean, it's hard to put in a positive slant on that. Why am I doing that? Our gas prices are terrible.
We got to do a hard stop on that one.
Yeah.
We have the best gas prices in America.
We do.
We're awesome.
More is good. Be better. So anyway, it's, but there are certain services that the federal government mandates you provide at some level. And so those tend to be the ones that those of us who barely get enough money to do those. Some of the areas that get more can do more things.
Right. And so volunteers are great.
Volunteers, boy, without the volunteers in our programs, we'd be 20 people.
Right.
Barely.
So, and Patty Berg, she's legend, right?
Yeah, Patty never slept, so that she had the advantage in that she could work pretty much 24/7.
I met people like that.
Yeah.
Betty Chin's claims she never sleeps.
I think, Betty, that's probably true. Yeah. I have to.
I want to do a shout out to Patty Berg.
Yeah.
Even though she's not present in this dimension.
Yeah.
Hi, Patty.
Hey, Patty. Yeah.
Everybody loves her. What a go-getter, right?
She was great. And when I moved up here, when I moved up here when I was 26 to take the position as the executive director of a small agency called Redwood's Ombudsman. And that ran the long-term care ombudsman program and senior legal services back in the day. And she was the director then of the Area 1 agency.
Okay.
And we got our funding. All of our funding really came through the Older Americans Act for the Ombudsman program and for legal services, which both of those are mandated services and funded.
Who passed the act?
Who?
Yeah, was it Was that like Johnson or before that?
God, because the funding didn't come until like the 80 or late 70s, but it happened. It was happening in the 60s.
Okay.
This stuff was all those things that were happening to recognize that we weren't supporting older adults. And the poverty that was being seen and things like that, but that it didn't really get funded and started up with any money until later, until that year.
Let's come back to the agency. I want to know about Maggie.
Okay.
Tell me, where were you from?
I was born in San Francisco.
Wow, in the city.
I was born there. I spent a great 6 months there, and then I moved to Palo Alto, and then grew up there. Had a great time. Not a bad place to grow up.
Great place.
Yeah. Had good schools. Had a crazy family. Still have a crazy family, but there's fewer of us.
Hey, who doesn't?
Yeah. I mean, get in line. And then I went to school in Santa Cruz, UC Santa Cruz.
Wow.
And after that, I moved to Sacramento. And after 4 years in Sacramento, where every summer people would say, it never gets this hot.
Right.
I said, I'm out of here. And so I started applying for positions in Seattle, actually. I was getting my master's in social work, and I thought, okay, I got to get back to the ocean. I get back nearer the water again. And so I was aiming for Seattle when the position that I told you about came open here. And I applied, and they picked me.
Pretty close to the ocean.
It's darn close.
This is where I point to my map. See my map?
I stare at your map.
Oh, wait.
Yeah, I'm staring at the map.
This is the best map ever.
I love this map.
We're going to show everybody that doesn't know where the ocean is. Wait, I have a light.
Or maybe we will.
Where's my... Oh, there it is. So this is Humboldt County, California. We're in Eureka, and there is the ocean.
Does he do this every show, or is this...
I try to use my map.
Oh, okay.
Yeah.
Okay, now, where's Hayfork?
Hayfork is right out... Hayfork is east, so it's along this 36 out this way. It's probably right here on this edge right in here.
Yeah, okay.
I've never done the quiz. Go for it.
Well,
Do I get a Dick Taylor bar?
You do. I do want to mention that, so funny thing, now that there's maps, you can Google places and how to get places, and we used to have state auditors come up. They don't come since COVID. And, we'd always be very careful. We say, they're going, well, we're going to come up 5, but we're going to take 36. And we're like, no.
No.
Don't do that. Don't do that. Okay.
No, Ned,
and
no.
so we would tell them, now the best thing, come up 20. That's come up that way. It's probably the best way. Well, when we got audited during COVID at some point, they were disallowing a cost because the person receiving whatever we were doing lived in Carlotta or whatever else is out there, and they couldn't find it on a map. So they were saying it doesn't exist. And we're like, you don't have the right map.
Yeah.
So from now on, if they ever come back, I'm saying you need to take 36. It's the best way to get here. Because then they'll see Carlotta. They'll know. They'll see everything. But
they're from Dinsmore.
Yeah. It was something like that. It's like just because you can't find it on a map doesn't mean it doesn't exist.
We're from Mad River, California.
Yeah.
Where?
It's crazy stuff.
That's funny.
I'm looking forward to them auditing again so I can give them good directions.
Early in our marriage, my mom came from Iowa, and she said, hey, Bob, look, it's a shortcut through 36. This is when 36 was like, this is 40 years ago. It was just crap. It was still dirt road. And he got so mad when they arrived. He was fuming.
Yeah.
Wanda? Anyway.
You are no longer my navigator.
Ever.
Yes, ever.
So back to Palo Alto, I have 2 new hips from Stanford that are, well, they're not new. They're 13 years old now. Same day.
You have 2 what now?
2 hips.
Oh.
Bilateral hip
I thought
surgery.
you were telling me you had twins.
No.
But then you said 13 years, and then I said, the hip. But you do kind of have twins. They're hipsters. I swear to God.
Twin hipsters.
You have 2 hipster twins. Or, no, that's repetitive. But
they're still working now. That's the good thing.
That's good.
Yeah, Palo Alto's fun.
Yeah.
We stayed up on the hill by the linear accelerator and
okay.
whatever that's. It has
SLAC.
SLAC. Thank you.
Stanford Linear Accelerator, CUZ.
The beginning of whatever that technology that gives us Google. Anyway. Beautiful area.
Microbrewery, but that's not it.
Yeah. So did you see the Grateful Dead growing up and hang out?
No.
No? Okay.
No.
I figured that would be
No, I
part
was...
of that.
Yeah, no.
Yeah, because they were all part of the Bay Area thing anyway.
Yeah. I was a little younger than them.
So
Still am.
You went to school in Sac? Or no, you went to Santa Cruz.
UC Santa Cruz, went there, and then went to Sac for my master's in social work.
Very cool.
Yeah.
UC Santa Cruz, what are they, the banana slugs?
We are the slugs.
The slugs.
Yeah.
What a great school that is. I've been to that campus. And
they changed it to the sea lions at some point. They changed because they thought, slugs, it's so.
Slugs.
But the slugs are back.
Lumberjacks were going to be the marble muralettes.
Oh. Say that fast. That. Yeah, no.
They weren't successful.
Yeah.
So you came and started this new job with Ombudsman?
Yeah, I did that for about 10 years. And then I went and I started working with a senior center. I ran their social services and their adult day health, Alzheimer's services.
It's down in Wabash over that way?
Yeah, California, which is where my offices were before. We were co-located there anyway. So then I transitioned to that. And then after we raised the money to build the Alzheimer's Resource Center, I said, geez, I need a break. And I joined the Peace Corps.
Wow, that's pretty rad.
Yeah, it's a joke because you don't join the Peace Corps if you need a break. But anyway.
What year was that?
That was 2011.
Did you travel?
I did some. I did some.
What'd you do?
Well, I traveled around Botswana.
That's
fun times.
Pretty rad.
Pretty flat. But I went to South Africa, Cape Town, Johannesburg. I went to where else did I go? Zambia. I didn't go a lot of places. Victoria Falls. I went there just because I wasn't there to travel. That wasn't why we were there.
Right.
But yeah.
Wow. How many years?
I was there for about a year and a half, and then they called me back. They said, a friend of mine called. He goes, Maggie, I've been in the Peace Corps. I know what you're doing, but we need you to come back here. I won't name his name, but and it was my dad had died a little earlier, and I was concerned about my stepmom. How well she wasn't doing that great. So I said, okay, fine. Yep.
I love it. I love a midlife Peace Corps journey. Yeah.
And there were about 40 of us in the group, 39. One didn't get on the bus in New York, but and about a quarter of us were over 40.
Wow.
And they call Botswana Peace Corps Light. Huh. It's it's in terms of African countries, it's doing pretty well, or had been doing pretty well for itself. And so, but yeah, we had about 20. Quarter of us were over 40.
That's really cool. I love that. So coming back, was it tough?
I couldn't go into a Costco. That was too overwhelming.
Wow.
I mean, it still is for there are times you have to choose consciously. I'm going to go in there with those people, but
those people.
And then when you go, you have to just chill out and not be one of those people. So I don't go to Costco unless I can just go with the flow.
Joni goes weekly, and she said there's never slow Costco anymore.
Yeah.
Used to be slow Costco times. It's never that way.
You know where I found out when it was, because I didn't know this, but apparently on Sunday they close at 6. I didn't know that.
Yes.
So I got in there at 5:30, and I'm doing a slow wander, looking at things, and I start looking around. And go, God, it's so not busy here. What's going on? And
that's the time.
And then I see someone. She's looking at me, and I go, "Are you guys closing?" She goes, "Yeah, we're closing." So I got myself. I took that seriously. Got myself together to go out. Get in line, and there are still people wandering around, not even caring. I'm it's 5:30 on Sunday. Just go. They won't kick you out.
Yeah.
Eventually, I didn't stay.
Eventually, you have to go, but yeah.
But it was nice. It was like everyone was just focused and moving, and yeah.
We used to do a date night there, which is kind of weird. I guess maybe not if you're from McKinleyville, but love you, McKinleyville. But yeah, we would go down and get snacks and food, all the weekly stuff, and there was no children involved, so that was a win.
Yeah, no.
There's no one yelling for anything.
Well, not your kids.
None of our kids.
Yeah, somebody's yelling for something.
Funny thing is, we'd see other people on date nights there. Yeah, that was the strange and funny part.
That's pretty good.
So back to your current gig. Tell what kind of divisions of A1AA are there?
Well, we do a lot of different things. We have. There's two main parts of what we do. One is we provide services ourselves, and the other is we provide funding to other agencies to provide some of the mandated services. And so the part of that is then we have to monitor them. We have to track how they're spending the money. We have to do all that kind of stuff. We also, part of that administrative piece is to develop an annual plan actually a 4-year plan that we update every year. That talks about the population, the needs, the issues, talks about what services we're going to provide with the money we get to try to address those issues, get input from the community on those on ideas and services.
Wow.
So, and that whole idea is, in a way, I think originally predicated on the fact that you could actually talk to people about what is needed and do those things because you would somehow have all the money you needed to do those things, and everyone would agree on what those things were. and once you did them for a while, if you were trying to solve problems, you would solve problems. But the issues are the same as they were 20, 30 years ago. I mean,
so they're the same. Okay.
Well, it's, housing, healthcare, transportation, caregiving. These are, we see it again and again. And why would they change? Why would they change if you haven't made locations closer to each other, if you haven't, if you haven't made built enough housing, if you haven't supported your healthcare system so it can it's not run by insurance companies, but it's actually run by people who are taking care of you and you're taking care of yourself. And if we don't have a system in place for anybody but family members to really be providing the bulk of care for people, though, how would it change?
Good point.
So we do that process on that end, and then we have to give a bulk of some of this funding to 3 different services. And by the time we give that to legal services, access, they call it, which is our information assistance, because if you don't know who to call, then you're not going to get anything. So letting people know we're there and call, and we may not provide the service, but we'll help you find the service. And then the other one is in-home, which is trying to provide some kind of service to people in their home. Well, what do people need? They need household chores done. They need laundry. They need shopping. They need cooking. They need personal care. They need all this stuff. And the problem with this is they don't need it once, one and done. If I need shopping or laundry done, I probably need that on a regular basis.
Right.
So a lot of these programs aren't funded to provide that on a regular basis. So that's challenging.
Sure.
And then we're supposed to be providing nutrition services, either a home delivered meal, Meals on Wheels, or that's for people who can't go into the centers, or at the center, what they call congregate dining. So we provide funding to the Humboldt Senior Resource Center and Del Norte Senior Center to provide meals. Well, we found out during COVID that, first of all, during COVID, a lot of people who would never have gone to the senior center needed meals. So, and we switched into drive-up meals so people could drive up and get their meals. But there's just not money for that. And the food costs, transportation costs is just going up. So these rules have been laid out and made by this law, and the state is supposed to put additional funding into it to match the federal government's funds. And local communities are also supposed to pitch in. But it's harder and harder for all those entities to keep doing that.
Right.
And so the funding has not kept up simply with the number of people that are turning 60 every year, living longer.
Wow.
Yeah.
That's so cute. So it's kind of like a giant wave that continues to build.
Yeah. And I'll talk about that. But I wanted the last service, 2 other services I want to mention is really that are funded by the Older Americans Act. One is family caregiver support, which is something that a lot of family caregivers don't think they're caregivers. My stepmom was the same. I remember showing up at their house one day, and she was stressed out. I've never seen her stressed out. And she was saying kind of not such nice things about my dad, which she's never done. And I looked at her, I go, Lorna, what's going on? You are really stressed out. I said, we need to get you some support. Yeah. She doesn't live here. She lives down in the Bay Area. I go, we need to get you some caregiver. I'm not a caregiver. I said, what do you mean you're not a caregiver? Well, I don't get paid. That's not the definition of caregiving, but family caregivers, they just think this is part of what you do for your spouse or your parents. And it is. And you're also a caregiver.
And you're a caregiver.
So a lot of people don't think about that, but there's support groups, there's education, there's counseling, there's respite funds to pay for somebody to come in and give you a break so that you can still go to your doctor's appointments, you can still go see your friends and all those things while you're caring for somebody.
Have a life.
Yeah. I mean, And then the last one is it's health promotion. So primarily we do exercise classes because fall prevention is critical. The people, once you fall once, you're likely to keep falling. And then you start limiting what you do out of fear of falling. You don't want to leave your house. You can walk around your house kind of holding on to things.
Sure.
You know, how many people, there's a lot of people who drive to the grocery store, grab a cart as soon as they can. And that's how they move around.
That's their walker.
And I mean, there's but they're doing it. And we're all adapting to whatever we have to adapt to. But building strength, maintaining strength. We lose a lot of muscle. We lose a lot of strength as we get older. If you're not doing something to maintain it, you're losing it. So those are the main things we offer. In Del Norte, we also do a lot of digital divide classes. So teaching people how to use iPads and things like that.
Oh, wow.
Our staff person up there is the one they come in to say, how do I get my phone to do this, that, and the other thing? We also have those classes, some classes here in Humboldt. We were heavy in Humboldt initially, and now we're heavier up in Del Norte. So we have a home share program. We match people with who have housing in a room to rent with older adults primarily who can't afford a one-bedroom apartment in this community anymore. You know, $1,100, $1,300, $1,500 for a one bedroom. What one single person can afford that if they're living on Social Security?
Right.
So we're trying to do what we can.
Yeah.
With a very limited funding base. And then we get other grants. We have our volunteer driver program, which is really important. We get money from the Caltrans. And again, it's volunteers driving people to medical appointments and grocery stores.
Love it. I love this program. I think it's really.
There's one last one you know about. The one you know about, the HICAP.
Let's talk about HICAP, and then let's talk about how. Let's do a shout out. You could do a shout out and websites, and can we donate money? Is that okay?
Oh, it's absolutely necessary.
There's ways to do that.
Yeah, you could walk in and give us bags of cash. You can go to our website. You could send checks.
Can I bring a car?
Can you bring a car
or a home?
Well. You can, I bet you can't.
Here's my home. I brought it with me.
It's a tiny house.
It's a mobile home.
It's for elves. Yes, we also, we're working with a population, and many of them have. These are the people we help who have resources. They're having to do their required minimum. What is it? That out of their retirement funds, they have to at a certain age. They have to pull the money out. And if they donate it, they don't pay taxes on it. Yep. So we take those things. But yeah, anything we can turn into cash or invest.
And how would we do that to get a hold of you before you talk about HICAP?
You'd call me at my office.
Okay. Or there's a website?
There's a website. But if you want to talk about that kind of stuff, give me a call.
So estate planning, I could bequeath an estate.
You could.
Yeah.
You could.
Huh.
I know when I look at, don't let my family hear this, but my estate plan is basically any money I have left in my 403B is going to nonprofits.
That's cool. I like it.
Yeah.
So what's the website address?
www.a1aa.org.
A1.A1AA.org.
A1AA.org.
That's an easy one.
Yeah. And it's the letter 1. Don't write out 1.
And how do we call you?
I said the letter 1.
You did.
Okay.
The number 1.
I'm just testing. It's
a number.
It's a number. The letter 1. How do you what now?
How do we call you?
Our number
with a phone, I guess.
Yo. Yeah.
How do I use this thing? I
don't know.
I'm locked out.
I think that's for cracking nuts. The one you have.
Oh, this one?
Yeah, that's what that's for.
Okay.
So it's 707-442-3763.
3763.
Yep.
442-3763. And if you're just joining me, Scott Hammond on the 100% Humboldt podcast with my amazing new best friend, Maggie Kraft. And as I'm looking over at Nick, he's amazing too, our producer. Nick Flores,
yes, he is.
He's the amazing guy. So, we're just talking about, let's top off with HICAP, and then I want to know what's in the catalog over there.
Okay.
Okay. So HICAP does what?
HICAP helps people with Medicare.
Yeah. And
it's one of our most popular programs because it really serves people of all income levels. And many of the services we provide, we tend to serve people more who are lower income. just by the nature of the kind of work we're doing. But HICAP hits everybody, and Medicare hits everybody, and it hits people really hard and really, really stupidly. I just got an email, not personal email, but from this guy named Ken Dykewald, who is a 76-year-old, I guess he said, a guy that's been studying and talking about aging and all this stuff. He's been around doing this, and he says, "Hey, I'm 76, and I'm willing to admit right now that you could offer me $1 million to explain Medicare to you, and I wouldn't be able to take the money." He's like, "I can't figure this stuff out."
It's got complexity.
And I was thinking he could probably figure it out for $1 million. I mean, hire somebody, but anyway, to help you. But it's unnecessary complex. I mean, most of us if you have insurance or even Medi-Cal, if you have these things, it's all taken care of. It's one thing. Your prescriptions are paid for part of it, everything. And instead, Medicare, they've got Part A and Part B, and then you have Part D, and then you have these supplemental things and Medigap things. And it's a scam. I mean, when people talk about wanting Medicare for all, what they mean is they want health care for all. We want health care for all. We don't necessarily want you to all have Medicare, but the idea of having that coverage. But Medicare doesn't pay for a lot of things, too. So, there's no dental, there's no eye care. All these things don't make a lot of sense.
Then there's MedSup policies that you can buy to cover some of that.
Yeah. And so, when people go, "Oh, I can't wait till I'm 65, I'm going to be on Medicare." Well, I'm going to be 65 next year. And I will be paying out of pocket as much as I'm paying out of pocket now for my insurance because my where I work pays the bulk of my insurance. So if I were unemployed at my age right now, I would never have insurance. I couldn't afford it. It's too expensive.
Right.
And I know people who are in that situation. So what we do at HICAP, the main thing where we get really super busy is during open enrollment for the drug plans, which is in the fall.
Coverage D.
Because these drug plans can change. You could have a plan you like and everything's going on fine. They might decide to take the drug you're taking off their plan. Or you might have another drug coming into your life that you weren't taking last year, and now it's not on that plan. So it's always a good idea to compare the meds you're taking with the plan you have to make sure it's the best for you, because things change.
And you have people that can guide that process.
We do. Unfortunately, we can't do it for like the 30,000 plus or however many there are people 65 and over in the 2 counties, but we teach people how to do it themselves. We do some workshops to just introductory, but you can do a lot of this on the website. But if you don't have internet, or you can't see your phone enough, having a phone and a website,
it's a combo,
So we do it for a lot of people who we have people come in, though, some of them, it's like their annual fall trek. I mean, it's almost like, well, we're getting ready for the holidays. Let's go have our Medicare appointment. And they come in and they go, "This is what I think I should do." And, "Oh, hi, good to see you." And then they, and then we reassure them that they thought it through well and they picked the right plan.
That's really cool.
But it's hard because I'm kind of like, "Hey, staff, let's help the people who can't figure it out by themselves. Let's help the people with like 15 drugs.
Let's coach those guys.
Let's help those people or help the people who qualify get some of the low income stipends and things to help lower their costs." So it's a balancing act because we want to help everybody, but there's no way.
I love this. I love your heart toward this. It's so daunting. It sounds like a huge challenge, and it's beautiful.
Yeah, it's a huge challenge, and sometimes it's ugly, but it's ultimately the work that our volunteers and staff are doing is just fantastic.
I bet there's a bunch of wins too, where it's like we helped Nova. She's great. She's rocking. She's dialed in.
There are some things that are happen that you realize if it weren't for our staff or somebody, but we are the ones. If our staff hadn't stepped in and helped, nobody would have known.
Wow.
Or they would, there are things that happen all the time that those of us in the system just assume that the hospital and the insurance and all the players in the process are all doing it right. and everything's going to work out fine, but that's not always the case.
Right.
And people don't know. You don't know what you don't know.
Right.
So we do from time to time see situations where, yeah, that's not against the law, but it's against good ethical practice.
Sure.
And so we're there to kind of support the person, because people don't want to stand up to the system. They don't want to, make a stink so that they don't have, all of a sudden they can't see their doctor. They can't go. I mean, they need advocates.
Right.
Same for the ombudsman program, going into nursing homes and advocating for those folks. Though a lot of those people, they're like, this is where I live. These people take care of me. If I rock the boat, I worry.
Right.
And maybe nothing's going to happen, but you can't tell somebody who's dependent on someone else not to worry.
Right.
So what we have to do is build, gain trust, work with them, and try to help them resolve the problems in a way that they're comfortable with. And that takes time and it takes sensitivity and relationships. Yeah.
So ombudsman, do they just do only care homes?
They do long-term care facilities, so
Okay.
skilled nursing facilities and what we call residential care facilities for the elderly, which
Granada,
now we call them assisted living. But like Granada is a skilled nursing facility. So, and
Timber Ridge.
Timber Ridge is an assisted living facility. The main differences is, well, some of it is resources. Nursing homes can be paid, reimbursed by Medicaid, Medi-Cal, or Medicare, but the Medicare is limited. Medicare is usually going to reimburse them if you're in the hospital and you break your hip and you need rehab. Medicare will pay for rehab. But once you get through the amount of days that they think you need to rehab,
you're on your own.
And if you don't keep getting better, if you're custodial versus improving, Medicare won't pay. But then you have to pay privately, or you get on Medicaid or Medi-Cal. I keep saying Medicaid because that's the world. But so that's a hardship for many people.
Yeah.
Assisted living is all, for the most part, in our community, private pay. So you can't even really get in there if you can't pay the monthly amount.
Which is not cheap.
No.
Yeah.
When I was a kid, as the ombudsman, when I moved up here, we still had a number of facilities that would take SSI, which is supplemental security income, which is a low bar. I mean, it's people living on SSI aren't making very much money.
Sure.
But they would take a certain number of people who were just SSI recipients.
No more.
And they don't do that now. I don't think there's any facilities. There might be one facility that has a mix, not just for older adults, for others, but then it's challenging. You can't afford to only take that. I mean, you have to run a business too. So that's the problem. We're not investing in the care of our elders.
Yeah. So it's education and belief systems to start that results in hopefully funding. And so how can we help? I guess we can volunteer. We could send donations of all sorts of, I always think about money. It's not just money. It's like, what if I was amazing at technology and I could help get older folks tech savvy? I mean, that'd be great.
Yeah, we do have volunteers who do our tech, our digital divide tech classes. We have volunteers, different parts of the community.
Yeah.
And, volunteers, most of our volunteers are older, they're retired, and so their schedules change or they want to travel. But it's one of the things, the volunteer driver program is awesome for a volunteer who wants to make their own schedule, because we have a system where you go online, you see the rides that are needed for the week, and you sign up for them.
Wow.
And if you're gone for a few weeks, you're gone for a few weeks.
So entry is easy to become a volunteer with you guys?
For some programs, yeah. For that, yes. For becoming a Medicare counselor or an ombudsman, no.
There's
it's
vetting,
like a huge amount of training, because we want you to tell people the right thing.
Sure.
But, for the exercise classes, there is training to become instructors. Volunteer driver program is the lowest bar, but you have to have the insurance levels and a good driving record that we require, because when you're driving for our agency, and if there's an accident, whether it's your fault or not, they're going to go after you. They're going to go after us. They're going to go after whatever. And so we have to have our volunteers have good records and the higher levels of insurance that you'd want to have.
And good insurance.
And good insurance.
Good insurance.
Oh, see, now I'm going there.
See?
People don't realize that it's like, it's not how much your car is worth. It's how much you might have in assets in case somebody went after you.
It's true.
And it's like, oh yeah, my car is not worth that much. But no, you're insuring against the worst case scenario of something terrible happening
or somebody's body.
Yeah.
Yeah.
Or somebody coming after you just because they can.
Yeah.
And then you might lose your house.
Yeah. Which we don't want that.
No, we don't want that.
That's why you have good insurance. So if there was, say, a woman age 65 who lived in McKinleyville, who's retired, kids are gone, husband still works or he's gone or whatever, and she had...
He works or he's gone. Those are different. But anyway, he's gone working? Anyway, pick one. Okay.
Yeah, gone somewhere.
He's gone.
Out to lunch.
Okay.
And so she had this time on her hands. She had this block of time, Monday through Friday, I don't know, 9 to 3 p.m. every day, 5 days a week. That person could actually give you all a call and have an assessment of his skill levels, skill sets, and get plugged into something really meaningful.
Absolutely. And if this woman wants to actually work that much, she can have my job.
Wow. Okay. We have an open position, folks.
No, but most people don't volunteer that much, but yes, those are, our prime time for most of the work we do is 9 to 5 kind of thing, but we do some outreach weekends. Our rides are mostly during the medical work schedule, but if we had more volunteers, we could do more grocery driving. We can do more things. There are now appointments people are getting on weekends. There's things that are happening. So the beauty about having volunteers for a lot of this work is you can just expand exponentially compared to the idea of having a staff person and what the expenses around that. So, and I have a friend who moved up here from Palo Alto, and he moved up here and he became a volunteer driver and he loves it because it was one way for him to get to know people since he was new, but also get to know the community where things were because he had to drive around.
What a great idea. So if I wanted to volunteer or suggest that I talk to this said person, we would call you at 707-442?
Yeah.
There's some ones in there.
No, 3763.
3763.
Yeah.
When we talk to you, it would be somebody in staff, right?
Yeah, what you'd call, we have our different program managers who will kind of help you figure out and we have an application that you can kind of, and information about all the different possibilities.
Is that online too?
It might be online because we just had a big volunteer expo and that our team came up with the idea of volunteer expo out at Dorney last week, and I think we've got a lot of the stuff online.
Cool. Can I volunteer too?
Yes, you can.
Thank you. I'd like to do that.
Yeah.
Hey, so if you want to volunteer, 707-442.
3763.
3763. Or the online is www.a1aa.org. That's really easy.
Yeah, yeah. And we'll help you figure it out. That different, our ombudsman and our HICAP volunteering are serious. Like you have to put a lot of stuff in your head. You have to pass tests. You have to, it's a commitment and it's an important commitment.
It's beautiful, yeah.
And some people are really looking for that kind of really knowledgeable, technical kind of work, and others are like, hey, I'd love to give somebody a ride. I give rides. I'm a volunteer. We have at our agency, staff get a certain amount of paid volunteer hours so they can volunteer doing things.
Oh, that's cool.
And I do rides every once in a while, mostly when it's somebody just really needs to go and can't reschedule and we didn't get a driver. And that happens. We don't want to drop rides, but if we don't have a volunteer. So I do it, and it's fun.
Nice. So volunteer, donate. Do you guys do Venmo or PayPal?
I think we have PayPal.
We'll look at that.
Yeah. I don't know if we have the Venmo yet. Venmo.
The Venmo. We're going to the Venmo. It sounds like a concert. We're going to go to the Venmo and watch Jackson Brown.
Yeah, the Venmo. Well,
so-
you just confused like two different.
I know, just threw everyone through
Yeah.
a loop. So before I ask you what you like about Humboldt, we do the quiz. I got to get my
we
bell
have a
here.
quid? Oh,
there's a quiz, yeah, because you get to win a fabulous.
Oh, no.
Oh, you know what? I really like the dark chocolate and peanut butter. That must mean you might like it too.
Absolutely.
Do you like chocolate?
I love chocolate. Who doesn't?
My wife tells me that most women, and she could say this because she's a woman, and I'm just repeating it, dude, that most women like chocolate. Is that true?
I have not done a scientific study, but the amount of chocolate that's being sold and eaten in this world would indicate that not just women like chocolate.
But men too.
Otherwise, whoa, women, we need to slow down a little bit. But
this is amazing.
Yeah.
Amazing chocolate.
Yes.
So having said all that, what do you like about Humboldt?
What do I like about Humboldt? I like, well, can I give an example of?
Please.
A few weeks ago, they did the party, the Dwayne Flatmo's naming of the alley.
Yeah.
And
were you there?
I was there. And what I like about Humboldt is, one, we do crazy things like that, fun, and just the whole nature of that race, and that you can live here and really make a difference in your community as an average person. And just going to that event, looking around and seeing all the people I knew, you know, of all ages, I love that. I love being able to go places and see people enjoying all kinds of fun things. Yeah, so I think I like that. I like being able to go. I like to be able to, for work, I like to be able to call people that I know and I've built relationships with, and we can help each other with different things. I'm sure that happens at some level in larger communities, but I think it happens more readily in smaller communities, and I like that.
Sorry, we missed the Dwayne thing. Dwayne was on our show. He's great.
He's crazy great.
He's so much fun.
Yeah.
What did he say? I said, "So how's your day going?" He goes, "Pretty good." What did I say? And he said, "I don't know. I just thought I'd go on your show. I don't know." It was quite funny.
He's
he had to be there. What do you not care for in Humboldt? We haven't started the quiz yet. This is the
this is the lead up.
This is the lead up.
What I don't care about for so much. I mean, Well, I had a visitor this last weekend who was from Rockaway Beach in New York.
Right.
And she came over. I call her my newest, oldest friend because I just met her. But she came to the coast to get away from the heat. And then she was just, I guess they don't have fog the same way in Rockaway Beach as we have here. And she was here when you were trying to fly back in. So she, she's like, this fog, I don't know if I can handle this fog. I like the fog. This is not like, but I like the fog because it does keep people from just moving here.
Yeah.
I mean, if we had everything we had here.
With great weather all the time.
With great weather all the time. And in fact, I know so many older adults who've moved here. They come for a weekend. It's great weather. Oh, they love this place. And they're like, oh, we don't have Kaiser, right?
Right.
And they just don't check out all the, but they think it's a great place.
There's no Macy's here.
There's no Macy's. Oh, thank God, actually.
There's no Trader Joe's.
There's no Trader Joe's. Oh, thank God. I mean, that's the thing. Those things exist somewhere else, and it's okay. They don't have to all be here. The things I don't like is how hard it is for people who don't drive to get around. And I think our communities are doing what they can with buses and stuff, but it's not enough. And yet our society, we're so tuned into trying to drive our own car that those of us who could be more involved in riding public transit and making it more effective, we're not doing it enough. But even then, I mean, even if it was running 24/7, if you're a person who can't get to that bus stop physically, it means nothing.
Right.
So, but that's certainly the case anywhere. But it's people. A lot of the folks here live remote. Or they live like McKinleyville. That's remote.
Yeah, we're remote.
Not like Willow Creek, but
we have a daughter in a wheelchair. She can't get to a bus stop. It'd be impossible. The roads and it's kind of laughable to think of Michaela getting there. Yeah, so the fog is a deterrent. That's interesting. And Rockaway Beach, the Ramones punk band.
Was that it?
Remember the Ramones?
Yeah.
Peter and Sarah, my friends, will check this. I think there's a song called Rockaway Beach.
There's a song called Rockaway Beach. I wouldn't have been able to tell you who sang it.
Right.
So, but
I got Nick fact checking that right now by the remote.
It's like, Nick, wake up and fact check. But
yeah,
okay.
I think you could do that on the fly.
Yeah, do that while you're asleep. So that and what else do I not like? I mean, there's all kinds of things to not like no matter where you go. And I think most of those things are comparable everywhere.
Right. Yeah.
I went to the Friday night market on Juneteenth,
mm-hmm.
and it was great to see all the different people out and the diversity of folks that were out.
Sure.
Because we see I think one thing I would say I don't like is I wish we weren't as white as we were. I mean, not individually, I can't help it, but I do always wish that, and so, but that's not something I hate. It's just something I would prefer there was a lot more diversity.
It was different.
Mm-hmm.
Good one.
Yeah, that's enough.
Yeah. Okay, quiz time.
Uh-oh.
Are you ready?
I'm ready.
Welcome to the quiz. And we still need to look at your magazine when we're done here because I want you to show our catalog.
Okay.
Are you ready?
I'm ready.
Question number 1.
Do I get the bell?
No, that's my bell.
Oh, crap.
And you don't get don't reach for the chocolate yet either.
No.
It's my chocolate. Well.
There are so many rules here, guys.
It's pretty heavy, man. You got to earn.
I'm sweating.
Earn this. Question number 1. What's your best day ever?
My best day ever?
Mm-hmm. Maybe one of them, but best.
A day that's already happened, or my hypothetical, not hypothetical dream. I mean,
you're getting ahead of the quiz.
Oh, shoot.
Your best day that's happened.
Oh,
I will get to the best
happened.
day. I will get to a best day.
Well, my memory doesn't go back as far. I mean, it goes back to childhood, and then there's like a 40-year gap, and then it goes back to yesterday. So
you too.
Yeah,
I do the same thing.
I mean, I will say that my best day ever. Oh, it was actually this new friend of mine, because she lives so in the moment and just does stuff and wants
East
this.
Coaster.
Yeah, and I have not been able to do that for so long.
What's her first name?
Her first name is Frankie.
Frankie, what's up?
Yeah, Frankie. I'll have to
still
tell
here?
her.
Or she Rockaway?
Well, she left like a few days ago, and I think she got as far as Crescent City. So, because she just, was exploring things.
In the moment.
At one point, I'm going, where are you? Thinking, oh, she might be in Oregon. I'm in Trinidad. She's like, I'm really glad I didn't come to Trinidad first because I might never have met you. I may never have gone further south than that.
Right.
I mean, that's how spontaneous she is. So
that's how cool Trinidad is.
Yes, also. And so just the best day for me is to be able to just do what comes, because my life is so planned out. So much of my life is planned out. So I would say that would be that week, the weekend with just doing stuff on the fly. That was pretty cool.
I love that. Just kind of be in the moment.
Yep.
Be present. I love that. Okay, question number 2. Worst day. What was the worst day that you can remember?
Well, I'm not going to talk about work-related worst days. How's that?
That's fine.
I would say, because nobody cares. And I think my worst day in recent memory was probably the day my mom died. But it was also good.
Sorry.
I was there with her, and I got to spend, because of COVID, I got to be in San Luis Obispo a lot more than I ever would have been.
Wow.
Life slowed down enough, and I could work from home. And I got to be with her and care for her and laugh with her. And, but that, that's always a sad day when you lose a parent.
It's hard, even if you see it coming.
She took herself out. I think she decided, she sent it, her last check she wrote was to the mortuary.
Wow.
And she even got to, there wasn't money. I mean, there's just enough money in her checking account for us to do what we needed to do. It was uncanny.
Huh.
And, she always joked, you should bounce your last check. She didn't, but, thank you, Mom.
Close.
But she worked hard, and she had savings and stuff. But in terms of the money available, Yeah, it was a hard day, but she did it. She had a great life. She's a wonderful person. And so
Lovely.
it's sad, but also,
What was your mom's name?
Eleanor.
Hey, Eleanor. Hi. Hi from here.
Yep.
Okay, number 3. What's the most thing that, where do you find fulfillment? What's most fulfilling?
I think for me, it's helping people. And I know it sounds, but what I will say is, the work I do at Area Agency, we are helping people my staff are helping people on a daily basis. I'm a little removed from that. I'm trying to keep the wheels turning and keep the money coming in so we can do what we do. But I also have this business that I do on the side, which is helping people transition, downsize, move into a new place, whatever. And that I get to see the results. I'm helping people with something that most people find very stressful, which is moving, especially if they've been in a house a long, long time and they don't know what to do with their stuff, and their stuff, they have memories and all the emotion tied to things.
Wow.
And then the physical challenges that some people have in being able to move and do the work. And so I come in and my team comes in and we just help them see that it's all going to happen. It's all going to be okay.
Yeah.
And that is very rewarding for me.
There's a roadmap for it.
Yeah.
That's pretty kind of a niche. I like that. That'd be really, really neat.
Yeah. We have a national organization, but I'm probably the only certified senior move manager in 150 miles.
Wow.
There's some up in Oregon, down in the Bay Area, but I'm the one here.
I love it. That'd be really useful. So there's Life Plan Humboldt too, which has changed its name, right?
Humboldt Commons. Yeah.
Dr. Ann Lindsay.
Yeah. Oh,
hi,
my
Ann.
God. Hi, Ann.
Yeah.
Not hi, Ann, like hi, Mom, Ann, but hi, Ann. I mean.
Hi, Ann.
We've been, yeah.
Ann and Phil Brooker, McKinleyville, wherever she lives.
Yeah. They're doing a fantastic work.
Have they broken ground yet?
And
I think they're getting there.
They're getting close. I do know that they're starting to get people to seriously sign up and pick the apartments they want, things like that. But
it's such a great idea.
Yeah.
I love that.
Yeah.
All right. Question number, whatever this is.
47. Oh, my God.
So who are you and what do you want?
Who am I? I don't know. How do people answer that question? I am is who I am.
That's Popeye.
I know.
I am what I am.
or there's was it Steve Martin? I was born a poor black child. That's not
funny.
it either. That's not it.
No. Well, let's start with what do you want? What would you like to see happen?
What do I want? I would just like to see people get along.
Wouldn't that be a thing?
That would solve probably most problems if people would just. And I think part of being able to get along is us not making so many assumptions about the thoughts that are going on in other people's heads.
Or intentions, motivations.
Yeah, we don't know. You don't know me. You don't know. I mean,
you don't know me, man.
I mean, people don't know what we're going. None of us know what someone else is going through unless they tell us, and even then, we don't know the half of it.
Don't know their pain.
We don't. And I've always felt very fortunate. Whenever bad things might happen to me, I would. How a lot of people are like, "Why me?" I go, "Well, why not me?" I mean. Theoretically, why somebody else? When you say, why me, you're kind of implying that it should be someone else.
I like that.
It's like, no, why not me?
Yeah.
So, that's who I am.
It's my turn.
Yeah.
My turn for something tragic.
Yeah. I mean, it's going to happen, but saying, why me,
Yeah, I like that. That you flip the script on that one. Well, it turns out that you've done,
Ooh.
Bonus question.
Okay.
Because this plays to your earlier question. You have your whole day off to do whatever you want to do. And I'm writing your check. What are you going to do? 9 a.m. to 9 p.m. And you got to stay there in Humboldt County.
Okay. Oh, in Humboldt. Okay.
Whatever you want to do. Frankie could come too.
Oh, Frankie. Well, then, it's the plan's going to go all like this. But We can start on one thing. What would I do? I'd sleep in late.
Oh, good one.
What's
late for you?
Well, late for me could be really late, but what I tried not to get late for me is maybe 10 o'clock.
That's so late.
It is so late.
I would love to sleep at 10.
It's so late.
9 would be like...
But you have to stay up late to make it work. So this is a thing. Yeah. So...
It presupposes some late night something.
Yeah, I don't... Yeah. What would I do? I'd like to go to have breakfast with somewhere nice. There's lots of nice places, but Brio's right up the street. I like when I live in Arcata, and I kind of have this rule that if I'm doing anything in Arcata, I walk, unless, it's raining or I'm carrying a bunch of stuff. But so I'd like to go places where I can walk.
That's good. And Brio's delicious.
Yeah, I'd go to Brio.
Is their coffee good?
I believe so, yes.
Yeah, they have some Blue Mountain something.
I don't know. I just love it. They're there. I like going there, and, they're great. People are great. They're friendly, nice. So yeah, breakfast. I like reading. I wouldn't want to spend my whole day reading, but I don't get to read as much, fun stuff. So I would want to have some time reading.
What do you like to read?
Well, I read mostly fiction, but I just read a book about the tallest redwood trees.
Oh.
And I'm really bad at remembering authors and names, so don't ask.
Sure.
But it was about it. It's the guy that wrote it. It's not from here. He's a journalist, but it's about a lot of people who are from here and teach at the university now. And this quest that they had over, since the 70s, 80s to find the tallest trees. And how they found them and climbed them and measured them and studied what's up there that none of us even have any idea. There are the life forms, the flora. Yeah, the flora. I don't think fauna, but salamanders that are.
That'd be some fauna too.
Yeah, that'd be some fauna. They're a salamander's a fauna, but they don't normally live in the very tops of trees because they need water. But there's water in these redwoods.
They can live up there.
Yeah, it's like I would never have thought this would be something that I would want to read a book about, but it was awesome.
They found the one tree down in Mendocino, right? There's a big one down.
Yep.
And then I wonder if Jim Campbell Spickler is part of that team because he's the director of the zoo, but he's the guy, the major climbing guru.
Yeah, and it's some professors. I think his name's Steve Sillett up at Humboldt, Cal Poly, and this guy that would never climb the trees, but just was convinced that, and he would call him up and say, "Let's go. Let's go here and look for some trees," and they would just literally go through brush and dig. It would take them all day to even get close to where they thought trees might be. And then he would always want to climb them. But it was like, I'm like, you guys, and they're in the middle of nowhere.
There's no roads, yeah.
And they keep, the thing is, these trees, they don't want anyone to know where they are because they're scientific, they're studying them. And if everyone gets wild about climbing these trees, they're just going to ruin them.
Right.
So, yeah, I'm so excited about this. It's crazy. I'm excited. But
that's a cool book.
It surprised me, and I very much enjoyed it.
Who's the author again?
Yeah. I am not going to go climb any of these trees, but it made me really admire that and understand it better. And yeah, I might climb a short tree.
Yeah.
Like a
harnessed end.
Like a stump. A really big redwood stump.
I would go upstairs to do a zip line through trees.
Yeah, they did that too. That was cool. So anyway, that was a pretty cool book.
Good one. Yeah. So you've went to Brio.
You
slept in Brio, read a book.
I read a whole book. I used to always go up to Patrick's Point when it was Patrick's Point. I always enjoyed going to there. So I might go up to Sumeg and hike around a little bit.
Sumeg's cool.
Yeah. It's accessible and, no big trees to climb.
It's pretty flat.
Yeah.
It's fun. A lot of changes of biome.
Yeah.
Cool.
I'd There's lots of things that I'd like to do. I mean, and some of these things are inside things. I like to go to movies. I hardly ever go. So, like, if I had a random day off, I could go see a matinee. That would be kind of
That'd be cool.
fun because I don't get to do that anymore.
A big screen movie.
Yeah.
Yeah, super loud, like Dolby stereo.
Yeah.
Oh, yeah.
I'd do that. I'd find some place to have dinner, with some friends, go out and have dinner. I'd probably go to Plaza Grill or the basement and have Shane at the basement, pick my whiskey or bourbon. I always let him pick what he's going to serve me.
Shane. Hi, Shane. Is he a good server?
Yeah, he's great.
And then is that Bill Chino? Is he still part of all that?
Those are his places.
Hi, Bill.
Hi, Bill. I'm going to see Bill tonight, probably at the party I'm going to. So
tell Bill I said hi.
I will.
So Shane's a pretty good bartender.
Yeah, he's pretty good.
What kind of whiskey do you like?
I seem to like all of it.
I have no preference.
So this is how my whiskey drinking story starts. Okay, my dad. No, wait, this goes way back. My dad, that was his whiskey, was his thing. And back then, we didn't have all the different kinds. But I think he'd pour himself what was that? One of those, either a Manhattan
or an old fashioned.
And so it looked yummy, and I would sneak sips, and it was always awful, right?
Right.
And but at some point, I have a friend. She drinks Jack and Coke, and we were at a conference, and she introduced me. I go, okay, I can do this here, and then I started thinking about. I go, Coke has a lot of sugar in it. I'm just going to drink it straight because I'm already getting enough poison with the alcohol.
Sure.
Why add that extra sugar poison?
Why kill yourself? Yeah.
Why kill yourself twice as fast? I'm going to do the slow one.
Pace myself.
And the other thing is, you drink it slower when it's whiskey. If it tastes like Coke, I'm going to drink it like it's a Coke. So,
right.
And then once I started doing that, I'm like, okay, Jack, I need to find something else. That's not what I want to drink straight.
No. So Scotch.
So yeah, Scotch. I'm not so much a peat. I don't think I like peat as much as Paul. Sorry.
Good one.
Good one, huh? Hey, Paul.
Not all Scotch is peaty, though.
No, but it's more likely. Then I went to Jameson's, which is Irish. I was doing that for a while, and then I thought I joined the Rotary. They have a whiskey fellowship or something, and all over the world, they get on a Zoom meeting. Everyone's sitting there drinking something.
How about that?
And they go around the room and introduce themselves and what they're drinking.
How about that?
And with 40 people in the room, by the time you get around, if you start again, everyone's going to be people are pretty, they've been drinking.
Yeah.
So I thought, this is amusing. And so I took some suggestions from them, and I went back and bought 3 little bottles, the smaller ones, to taste. So I bought these, and I tasted them, and I tried to figure out which ones I liked. And then when it came time to put the bottles in recycling, I realized the flaw with this is they all got empty at the same time. So I was putting 3 empty bottles of whiskey bottles in the recycling at the same time. I'm like, that's not a good look.
No one would ever know.
No one. Well, now they know. I told you. But so anyway, so I've just tried different things. And
so what's your jam of those 3 or of those 9 or whatever you?
What I'm doing, yeah. I had some. What did I have the other day? It was called Redemption.
Redemption, huh?
I remembered that. I like that. I think that was a bourbon.
My son-in-law's a Scotch guy. The green dot, yellow dot, red dot.
Yellow dot.
Yellow dot's delicious.
He served us yellow dot one night.
Blue dot is extremely amazing.
Yeah.
It has notes of guava and papaya, which is in a whiskey.
Yeah.
What? Anyway. Hi, Matt Mulaney. What's up? He's in Medford. You can't see him right now.
Oh, okay. I was going.
How did he get here?
The way you said that, I thought he was behind me. It's like, so I would go and have maybe that before dinner and have dinner. I don't know where I'd have dinner. I'd have to see what I was in the mood for.
All right. Get a snack at Plaza Grill and wind up wherever.
Yeah.
That's a really colorful day. I like your day. That's a good day.
Just chill, nothing crazy, but just kind of spending more time doing things that I don't have time to do normally.
Yeah, I like it. I like it a lot. Yeah. I like you a lot. You're fun.
Thank you very much.
You're welcome very much. Thanks for being here. Tell us about your legacy. What are we going to say at your funeral and your celebration of life? Or just gravestone or all of it?
Well, I'm looking forward to doing a green burial.
Mhm.
So there will be no gravestone.
Mhm.
You'll just be out there going, I think Maggie's around here somewhere.
She's around here somewhere. I have a sense
Stepping on her.
like in someone's backyard type of thing?
No.
Or just out in
I'm not a cat.
in the woods?
No, there's a group here locally. Rebecca Stauffer
Right.
is working. I know her name. It came up recently. I mean, I know her.
Are they the Neptune Society or
No,
like
it's
that?
a different thing. But they've got some land up in Neeland,
Mhm.
and they're starting to work on that locally. So,
Spread the ashes type of thing?
no, it's a green burial. Well, they might do that, but what they do is they actually wrap the body
Mhm.
untreated
Mhm.
in something, and it just becomes part of the earth again.
They've done it for eons, right?
Yeah, before we could, except for when those embalmers, I think the Egyptians, did they do who made it so we can find bodies?
Probably the Chinese, but yeah, probably Egyptian. They made it famous.
I'm so sorry. Who made it so we could find bodies?
Those bodies.
Although you think about it, I mean, they're finding bodies all the time and they're not. I mean, it's random.
My best joke ever is, do you know where they hide the dead bodies?
Where?
Page 2 of Google. You want to know why?
Why?
Nobody ever goes there.
Page 2 of Google.
Somebody said the other day, is there a page 2 of Google? I go, my point. You just made my point.
I think there is, but if you search that far down, you're not getting as credible stuff as at the
You're
top.
getting something else, yeah.
Well, and who knows anyway what's credible, but
anymore.
So I don't know what they'd say.
So green burial.
And I don't know what people would say at my wedding, funeral, 4 weddings and a funeral.
Uh-huh.
I don't know what they'd say.
Okay.
But I don't know.
They'd say something.
They'd say something.
They say, gosh, she did a great podcast with that Scott guy.
They'd say something. Something would be said.
Something. They would say something.
Do you ever I go to different things like that, and sometimes, they plan it out very formally because they don't want a lot of people getting up and riffing, which is often a good plan. But sometimes they need a little riffing.
A little riffing's fun.
And so I had a good friend of mine pass away, and they ended up doing the thing at the Elks Lodge. And so he was an elk, so they did the formal elk. I don't know if you've ever been to one of those. They did the formal elk remembrance in the special room.
Been to the special room.
And special room, became an elk.
Yeah. If I told you what happened, we'd have to kill you.
That's right. I became an elk. Whoops.
You did.
Didn't see it. Okay. I touched the microphone.
Oh, no.
Accidentally.
He didn't see it.
He didn't see it, but he might have heard it. I don't know. He's like over there.
So you became an elk and they did a...
So, no, he was an elk. He died. They did that there. Then he was a veteran, so they did a veteran thing.
Okay.
And then we all went out into the bar area, and then there was food. And there was nothing planned for him, for the rest of us to say anything.
So the riffing happened.
No riffing happened.
Oh.
It was one of nobody was in charge. The family, and I kept saying, "Oh, let us help you plan something. People are going to want to talk," and it didn't happen. And it just felt like, it felt awful.
Yeah.
So I still talk. I riff about him all the time.
Good.
But no. So that shouldn't happen.
Yeah. After riffing.
Yeah, there needs to be a riffing.
I like it. That's fair. Yeah. Let's say stuff.
Yeah, say stuff.
Well, cool. I think we said a lot of stuff today.
I hope so. Oh, do you want to hear about this real quick?
Yeah, real quick. And then the shout out to your website.
Okay. So what this is, I can just show it to you.
Sure, right over here.
Oh, look. This is another project we're deeply involved with, which is the Aging and Disability Resource Connection. It's our organization, along with Tri-County Independent Living, along with the IPA, which is Independent Practitioners Association, and NCHIN, all these acronyms. But it's about trying to help people find resources with better coordination and referrals. So we're not just saying, here's a phone number, have a good time with that. Here's the book. But also, let's hand you off. Let's do a warm handoff. Like, you need a resource and you don't know, you want us to help connect you. Let us help you connect you. So we put this resource is a bunch of different, and this is
big print. Yeah.
Big print. What we did is we took the best elements of what Tri-County used to do in their resource guide and the best elements of what we had been doing forever in our senior information guide and put them together.
Love it.
big print because nobody should have to strain to read things. And because we couldn't make as many of these as we would have if they'd been out of paper or, the little newspaper, it's also online. So we have these cards where you can scan the QR codes.
Beautiful.
So people who want something in hand, don't have internet, we got this. If you've got internet,
Smart.
you can go to the website for that.
Oh, brilliant.
So we have a different website for that, which is called, it's northcoastadrc.org.
Yep.
And it's not a new agency. It's more about coordinating the services of agencies that already exist.
I love that guy to have a copy.
Yeah.
Yeah. Beautiful. So we could reach you at 707-442.
3763.
And your website is?
A1A.org.
And if we wanted to give things, we could give time, treasure.
Or talent.
Love it.
Yep.
Thanks for being here, Maggie.
Thank you.
And thanks for joining us at Scott Hammond 100% Humboldt podcast. Like us, love us, send us gifts. And we're on all the podcast platforms, and we're on Humboldt Access TV, and we're on YouTube. And thanks to our producer, my main man, Nick Flores. Thanks to Advanced Security. Thanks to Dick Taylor Chocolate. Thanks to Quality Body. Thanks to Joni Hammond. I'd like to take a minute and just thank many people in my life, but I won't. Thanks for being here.
Thank you.
All right. See you again.